Hello, everybody, and welcome back to Real Pod. This episode is packed with so much good information. You were going to be educated. I was educated. Dr. Thaïs Aliabadi is here, also known as Dr. A. She is probably the OBGYN to your favorite celebrity. You may have seen her on Keeping Up with the Kardashians delivering Khloe's baby. True story. She is a renowned, like one of the best, if not the best in the world, OBGYN. And she is an infertility specialist based in Los Angeles. She's going to share her story today about how she immigrated to the United States to create the private practice she has now. And it is mind-blowing. On top of that, she's also going to be answering all of your questions that you submitted through the RealPod Instagram that we all are struggling with and need answers to. Like, how do I know if I'm going to have okay fertility when I want to have kids? How do I know if I have PCOS? How do I know if I have endometriosis? How often should I be getting my period? And what should I be asking my OBGYN? Dr. A is literally going to map out for us today exactly what you need to say to your doctor. She wants you to be empowered. She wants you to march in there with a list and get the care that you deserve. So stay tuned for that. She's literally going to spoon feed it to us. It's incredible. She's also going to get really specific on what tests and exams we should be doing no matter what our age is. She literally will give us the age that you need to go get your egg count checked. So listen to these stats. She's also going to debunk the most common misconceptions about women's health. Unfortunately, there are too many to count, but Dr. A is going to be clearing the air today. Be sure to check out her podcast, also at Dear Media, called She MD. I have been a guest, so check out my episode. Without further ado, let's get started. Please help me welcome Dr. A. Dr. A, welcome to Real Pod. I'm so happy. I feel so lucky to have you here. Your wisdom, your expertise, you're going to give us the information we are all desperately seeking.
Thank you so much for having me. I love this studio.
Oh,
it's
thank
beautiful.
you. I was so honored to be on your podcast, She MD. Congratulations. That's been amazing. You guys have so many incredible interviews, and I'm blown away that people can access your knowledge for free. That's like the beauty of podcasts and technology is you're not now, only exclusive to these, obviously I tell everyone you deliver their favorite celebrity's kid, probably, right?
Yeah.
But now people have access to your Instagram, your podcast, which I think is incredible that you give that away to so many.
I mean, for years I've practiced OBGYN and I didn't do this to see celebrity patients. Patients are patients. When you're a physician, and I always say when you come to my office and you wear that pink robe, 90% of the time I really don't know who my patients are, what they do. As a physician, we go in thinking what the problem is, what do I do for this patient, how do I solve her problem, how do I make her feel better? So the last thing we think is who the patient is, at least in my office. So, when actually people tell me you're a celebrity doctor, or a celebrity physician, it almost hurts me because I'm everyone's physician.
Yeah.
And I treat all my patients the same. So it doesn't matter to me when you come to my office and you wear my pink robe, you're my patient and I'm your doctor. And everyone gets the same exact treatment.
I love that. And I think it's a good reminder too that, you didn't seek out to excel in this profession to work with celebrities. You put your head down, did the work, became very, very, very good, that now, these people are seeking you out to deliver their baby, to help them with whatever they're going through.
Right.
So it's really just a testament to the incredible job you've done over the span of your career.
And I think my patients know that too. I mean, I've had huge celebrity patients. I didn't know at the time they were huge. And I would ask my medical assistant or I would ask in the room. I have one that I can't really mention, but I asked her. She's like, Dr. A, I got engaged. My fiance is, I don't know, in such and such country, and we're going to get married. And I'm like, oh my God, who is it? I'm so excited. I was asking so many questions. And then my medical assistant who scribes for me in the room tapped me on the shoulder and wrote something on a piece of paper. And I read it. She's like, stop asking questions. She's marrying this person. I was like, oh, I didn't know that.
That's so
and she's
funny.
like, everyone knows. But I mean, I think for most of us physicians, we just go to work to make our patients feel better. That's why we went into medicine. So again, but thank you for having me.
Yeah, I'm so happy to have you. And I'd honestly love to start there with what brought you to this field and if you always knew you wanted to do this type of work.
You know what? No, not necessarily. I grew up in Iran in a very well-off family before the revolution during the Shah of Iran. I don't know how much history you know of Iran. But I grew up I went to a French school in a very affluent, super educated family. And unfortunately, when I was 8 years old, the revolution happened and my country turned upside down. They took my dad's passport away. They froze his bank accounts. He couldn't leave. He didn't have money. And literally our lives, turned upside down. And I got stuck in Iran for almost 10 years because we couldn't leave. And I ended up going from my yuppie, French school to a all-girls school, with a lot of religious influence. And I didn't come from a religious background. So it was just a lot of changes. And when I was 17 and a half, we finally got our green card and we left Iran and I came to United States. Growing up in Iran, as a woman after the revolution, all of our rights were taken away. If we had to suddenly cover our face. Women could not, we couldn't talk to boys on the street. It was almost like I was quarantined for those 10 years. We had the war. We lost all women's rights in Iran. So it was a very difficult time for me to grow up. So when I came to this country, all I could see was the freedom, right? And I couldn't imagine how much these Americans were blessed with at the time. And I constantly compared my life to the life of, young women in this country. So growing up in that environment, I think, and having my childhood and growing up in war, I was drawn to doing something, to healing people, to making this world a better place, to standing up for women, to being their voice, everything that was taken away from me when I was growing up in Iran. And I think, my mom, if you grow up in a Persian family, you either have to be an engineer, you have to be a lawyer, or you have to be a doctor, and there are no other options.
Mm.
So I didn't want to be an engineer. I didn't want to be an attorney. So I was left literally with medical school. I started taking biology classes. I absolutely loved it. And from there, I went to Berkeley, chose to go into medicine. But because I had been in this country for only a few years, I bombed my MCAT. And, I didn't get into any medical school, even though I was graduating the top of my class at Berkeley. So I took every English as a second language course you can possibly imagine. And then I graduated from Berkeley, didn't get into medical school, did a master's program at Georgetown, graduated on top of my class. And from there, I got into medical school. And so it was a very rough patch. But once, when you're a third year medical student, they start rotating you to different rotations from urology to surgery. And I had such big attraction to women's health because honestly, and people ask me, why did you pick OB? There's no magic behind it. I just didn't want to deal with men. I did not want men to come to my office. And I don't know what it was. Maybe it's because of everything that happened to me as a child. I don't know. I don't know what it was. But I went to my mom one day and I'm like, she's like, what are you going to be? I'm like, I don't want men to show up to my office. And I had some bad experiences during my rotations in urology when I was at Georgetown and some other rotations. So I was left with pediatrics and OBGYN. I loved to operate. And I figured in pediatrics, I would still have men show up to my office. So that's how I picked OBGYN.
Wow.
So I think there was a drive inside of me to I loved being with women. I loved to surround myself with women. And that became my passion. And when I started my practice at Cedars all by myself, I literally rented a space maybe 3 times the size of this room with 0 patients. But I believed in myself. I was super well trained. I had graduated top of my class in my residency program. So I was ready, to do this. It was a little intimidating, started my practice, and very quickly, I noticed that women get dismissed in medicine. And I started noticing the PCOS patients, the endometriosis patients, all the infertility patients. So eventually, over the years, when you first come out, even though I was really well trained, you still need experience with patients. So I started really focusing on helping women with pelvic pain. And I think that's how I got into the path of endometriosis. One thing that I think people always tell me, how did you build this practice? And I don't know, maybe it's because of my childhood, but I cannot see women in pain. I cannot see them in pain. And I think from that brings an empathy with it. if you come to my office, when I do a simple cervical biopsy, I numb the cervix. I give laughing gas. I give an Advil. So my patients feel no pain. And, when they ask me, how come you have all these gadgets in your office? And I always say, because I can't see women in pain. I really can't. And I think that empathy, that love, caring for all these women over the years that I've seen for them, becoming their advocate, becoming their voice, uh, it's the passion I've always looked for. And I got myself here because of taking all
Wow.
those steps. So,
That is such an incredible journey. And I feel like you've had to overcome so much. There's been so much resilience. Mm, Do you frequently still think about the comparison of what your childhood, teenage years were like and then the country we live in now? I mean, does that still come to you?
it doesn't, but I will tell you, if you ask me about my childhood, I don't remember much. And sometimes deep in my heart, I worry that maybe some other thing happened to me in life that could explain all this. It could explain why I didn't want to have boys. When I was pregnant with my first daughter, my brother-in-law came to the house and said, "You know what? You're going to have only boys." And when he left, I started bawling my eyes out because I'm like, no, 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 I want women. When I was in medical school, I only wanted to go to rotations where women were there. When it came to, picking a residency, I picked OBGYN. I became the queen of chronic pelvic pain because I can't see women in pain. Something must have happened to me. I might not be able to pinpoint it, but I did grow up in war. I definitely had trauma, even though I grew up in the most loving family. Something in my childhood must have turned on this switch for me to go down this path.
Yeah.
And honestly, I always talk to my friends when they say, you have an ego. My ego, which is Dr. Thaïs Aliabadi, right? If we talk spirituality, is I feel like every time I see a patient or I heal another woman, I'm almost like building this ego that you want to break, but it helps me in a way protect myself from what's out there.
Yeah. It's interesting that as you look back on it, you think about like, was there one thing I'm not remembering? But me hearing your story is like the decade you spent having to live by those rules in that sort of society is enough to justify
Not
these
wanting to,
feelings.
yes.
Yeah.
And it was always men who would come to our school, cover your hair. They would take you if a sliver of your skin was showing, or if your socks were not long enough. So I had a lot of that I carried with me. And I think that's what pushed me to only surround myself with women. Thank God I have 4 daughters. I mean, I'm so blessed. People are like, don't you want a son? I'm like, I love my daughters. I just love this life that I have. I go home, I'm surrounding with so many women. I go to work, I have the best patients. My staff, all women from
Yeah.
all sorts of, backgrounds. And I just think I'm the luckiest person. And I made my dream come true. And along the way, uh, I was this passion, this empathy that I have for women. When someone comes and tells me I have pain, I literally feel their pain. And I don't know how to describe it. I don't know why, but I think that's what pushed me to be who I am today. And people come to me, they're like, how did you get here? And I'm like, I don't know. Do you know what I'm saying? So you
Yeah.
can't
A
really,
calling, a passion, a purpose.
you have to have a passion.
Mhm.
Without passion, you don't get anywhere in life.
I have to ask the father of your children what made him feel safe and special to create family with.
Oh my God. He is, for anyone who knows my husband, he's 1 in a billion. There's no one, and I'm not just saying this because he's my husband. I'm a very honest person. He is out of this world. He's so nice. He's my first boyfriend. I met him at Berkeley. And I've never been with anyone else. He's just a sweetheart. He has so much. He's in touch with his feminine side. Let's put it this way. We were at Stanford. I have 2 daughters right now in college, and we were having lunch with a professor of my daughter this past weekend. And she was speaking so highly about my daughter and how amazing she was. And my husband starts bawling his eyes out in the restaurant, and my daughter's kicking him from under the table.
Wait, that's so
But
sweet.
he's so sweet. Sometimes I'm like, just pull your shirt up, turn around. He's like, why? I'm like, I want to know if you have angel wings, because The way he treats me today, if he was here, you would think he met me yesterday.
That is so
I'm
precious. And honestly, you deserve that with what you went through, having this type of life partner, having 4 daughters. That feels like the work of higher power,
Isn't it?
you know?
He helped heal me. I mean, he's so loving. I mean, I have to say, I'm a pretty cool wife. I do so much for my family, but it's compromise. And I think we both compromised and we function as one unit. So, which is magical, but he's changed my life. I came with so much trauma from my childhood, and with him, you can't even pick a fight with him. You can sit here and try to irritate him. He's just going to say, I love you. Can I get you anything? After a few minutes, you're like embarrassed of yourself. So we've been together so many years. We've never been apart. We've never been separated.
Your life story is so interesting. I keep having questions I'm going to have to ask, and I want to ask you these questions about health, but I need to keep talking about this because you're so freaking inspiring. Something coming up for me right now is a lot of people who have childhood trauma, or they're used to something being one way, oftentimes we'll see them seek that out and keep replaying the pattern or the roles. And it sounds like you went complete opposite direction of like, I want to feel safe. I want to be respected. I want to find that type of person, as opposed to being like, I had boyfriend after boyfriend who was authoritative, who did that. What was it that you think had you seek the better path?
I think when you grow up in a childhood, when you lose everything, when you see your family lose everything overnight, when bombs are being dropped on your head, when you have to suddenly cover your face and all of your rights are taken away. In a way, to be honest with you, when I came to this country, I thought the heaven's gate was open. I kept comparing myself to all the women that were stuck in Iran. And the only thing I could see is how lucky I am to be here today, to have all of this for me. I mean, they give you loans to go to school. I mean, there's no country like this country on this planet Earth. And I always say Americans don't know how good they have it. When you come from another country, you have so much gratitude, so much gratitude. Having said that, I think, when you have childhood trauma, a lot of it's like amnesia, right? You block it. It's so traumatic that you don't even want to deal with it. But subconsciously, it makes you resilient. It makes you get up. You almost have to protect yourself. You have to have a shield to not allow other people to hurt you. And I feel like going to medicine and healing people is that ego, is that shield that I built around myself in a way to protect that weak Thaïs Aliabadi, that was that little girl that was, had so much trauma growing up. And the interesting part with me is I didn't know I had trauma until 4 years ago when I went to dinner with a friend of mine. And his wife was telling everyone at dinner how she grew up in this country and she had so much trauma. And I was like, what? Me telling you, like, I feel people's pain. Over dinner, she starts sharing how she would come home when she was 12 and her mom used to work and no one would be waiting for her at home. And she would be alone from 2 to 6 p.m. And as she was saying this, I really don't like being alone. So I started talking to her and I'm like, I'm so sorry. I feel your pain. I'm scared to be alone by myself right now at home. It's amazing that I'm so sorry about your trauma. And then I finished the sentence by saying, I've never had trauma. I can't even relate to that. I'm so lucky I didn't have trauma growing up. And then her husband, who was a physician, who's my colleague, he was sitting across from me. He's like, you don't have trauma? You grew up in war. You had bombs coming on your head. Your school closed. You had to leave your country. You had to come here. You had to start over. And as I left the dinner in the car with my husband, I was like, I guess I did grow up with trauma. That's the amnesia I'm talking about.
Yeah.
I think when the trauma is so severe, you kind of push it down. I honestly did not think I had trauma. The next day I called my friend, her husband. I'm like, I hate you. He's like, why? I'm like, I was living this beautiful life. And now I realize I grew up with a lot of trauma.
My bubble, and now I need to go to therapy. I mean, that's also common with women, is we're constantly like, oh, it's not bad enough. And it's like, if you're sitting here with your experience saying it wasn't bad enough, not trauma, it's like we're all minimizing. We're all, convincing
That's what
ourselves.
we do.
I know, it's so unfortunate. Something else that you said I wanted to hear about was when you bombed the exam, your first exam, you said that I mean, that must have been a
It was
huge
embarrassing.
gutting. I mean, how did you think about that, recover from that with all the pressure from your parents and your pressure to succeed?
Well, not getting educated was never an option in my household. My mom was highly educated. My dad was highly educated. So when I bombed I got a 6. I think the score was out of 15. I did well in math, but in verbal reasoning, I I I think I got like 40%. I was halfway done with my Scantron and they're like, time's up. So I started bubbling. I don't know if I bubbled all B's or all C's.
Right.
Anyways, I failed.
Hail Mary. Was it mainly a language barrier, you
Yes,
feel? Okay.
100%. Because my first language was Farsi. My second language was French. So I knew no English. So by the time I was taking the MCATs, I had been in this country maybe 3.5 years. It's not enough to imagine taking an SAT.
I mean, I couldn't take it
Going-
in my own language, so I can't imagine knowing the
It's so
material.
hard.
Yeah.
And I was like, this is so unfair because I got all A's, but I'm bombing this test and everyone is just looking at my score on the MCATs. But anyways, you come out resilience, right? That's one thing you learn with trauma. You go down, get up, because nobody else is going to help you get up. You just have to get up. So I got up, and the only way to do it at the time was a program extremely competitive. At Georgetown, they would take 120 students, and the top 10 would go to medical school. So I got admitted into that program. It was the most, I mean, there are no words to describe that program. It was so competitive.
More trauma.
No, like that's real trauma.
Not where you grew up, but
Not
school.
bombs, not bombs.
Medical school.
Georgetown master's program was trauma. But I ended up, I think I was third in my program. So obviously they had to take me to medical school. I skipped 1 year of medical school. And then that's how I started my medical journey. So I'm very
Wow.
grateful for that program because it gave me a chance to become who I am today.
You are a freaking badass.
I am.
Yes, you
Nothing
are.
takes me down. I get up.
Iconic, Dr. A. Iconic. Wow. I was not expecting like the most inspiring life story I've ever heard.
Aw.
That's incredible. It's incredible.
And then I had breast cancer.
Oh
and
my
then, yeah.
gosh.
Anyways, I can write a book about my life.
You should.
Really.
Would you ever do that?
I think so. There's parts of it that I haven't shared with the world, but eventually I will write a book.
Well, I will buy it, pre-order, and read it immediately.
You're so sweet.
I'd love to get into some of these questions from the Real Pod listeners
Okay.
who are dying to get your expert take on so many issues that I think all women are facing and just common questions. So take as long or short as you want to kind of answer these, but we'll start with PCOS. So we've chatted that I
Yes.
believe I have this.
Yeah.
you confirmed. So what does it mean if you have polycystic ovarian syndrome?
So polycystic ovarian syndrome is a very common condition that affects 15% of women. I said that to a patient of mine today. She's like, that's not too many. I'm like, 15% of women in this country is a lot of women. And majority of them, 75 to 90%, are not diagnosed, which is the scary part. It's a top cause of infertility for women. So imagine if men had a condition that was their top cause of infertility and would go dismissed, and 75 to 90% of them would not get diagnosed, it would be a revolution in this country, right? So polycystic ovarian syndrome is a hormonal imbalance. Usually it affects these patients usually you need to meet 2 out of 3 criteria for the diagnosis. Irregular period being one, polycystic looking ovaries on ultrasound. So polycystic ovarian syndrome does not mean cyst. It means these patients have a lot of follicles. It's a specific finding on ultrasound. So you don't have to have a cyst to have polycystic ovarian syndrome. And number 3 is elevated testosterone symptoms. Very important. Acne, facial hair, body acne, hair thinning are some of the symptoms of high testosterone. So you need to meet 2 out of 3 criteria. These patients usually have a mood disorder. They tend to be anxious. Sometimes they suffer from depression. A lot of them struggle with weight. These are patients who gain weight and they're eating the same thing, doing the same exercises as their skinny friend in high school, but they keep gaining weight and their skinny friends stay the same.
Mm-hmm.
So they gain weight unexplained. And usually they have family history of either diabetes, overweight family members, insulin resistance, or PCOS family members. And usually when you combine insulin resistance with gaining weight, plus a mood disorder, anxiety and depression, the two together will cause an eating disorder. So you'd start going down the wrong path. And I always say, if you want to catch the PCOS patients, go knock on the doors of these eating disorder centers. And you'd be shocked how many of them are dismissed PCOS patients who are labeled as anxious and depressed and, labeled with all sorts of diagnoses, but no one takes the time to diagnose them with their PCOS.
So let's say someone has PCOS, like myself and a lot of my listeners. How can you treat it? Is there a one size fits all model?
No,
Okay.
not at all. So there's no cure for PCOS. It's part of your DNA. Now you can improve the symptoms. Lifestyle makes a huge difference, especially majority of PCOS patients have insulin resistance, so they don't process sugar well. So a low carbohydrate diet is a must. Exercise is very important. Even if you don't have time to exercise, go walk for 10 minutes after each meal. It'll significantly reduce that load of sugar in your body. Insulin resistance happens when we eat and our carbohydrates in our body breaks it down into glucose. Glucose stimulates our pancreas to release a hormone called insulin. The job of insulin is it takes the sugar from the blood, opens up the receptors on the surface of the cell, pushes the sugar into the cell where it turns into energy. So that's how we clear sugar out of the blood. Insulin resistant patients, this system doesn't function as well. So when they eat sugar and their insulin gets secreted, their cells are insulin resistant. So sugar can't go in, bounces in the blood. It upregulates your insulin. Insulin is a fat storage hormone, and it can do two things to the body. Number one, it tells your body the cells are not taking up this sugar. Take this sugar and store it as fat. These are patients who say, I have one slice of pizza, I gain weight. And the second thing that a high insulin does, it can stimulate the ovaries to secrete more androgens or testosterone. And it is that testosterone that can cause irregular periods, facial hair, body hair being the most common symptom, acne, hair thinning. So, and different patients have different symptoms. The reason it's not a one size fits all because not all patients have all the symptoms, right? Majority of patients have most of the symptoms. But if it's an irregular period, then we can fix that. I have a new company. It's relatively new, but for years I used to give multiple supplements to my patients. Finally, I made this one supplement called OV.
Yeah.
And basically it has 16 ingredients towards balancing the hormones, balancing blood sugar. And PCOS patients tend to have chronic inflammation. So it lowers that chronic inflammation. It has a lot of anti-inflammatory and a lot of antioxidants. So you have to see where the problem is and you start resolving those symptoms.
I think this is an important dialogue to have because I've told you that I used to have an eating disorder. So talk about food and taking things out of my diet, it could be triggering, right? Because it's if I'm not supposed to have carbs or not as much sugar, then
you crave it.
Opening up a can of worms in my head mentally. And I personally would just never take a GLP-1 just because that's just how I feel. Right. What I need to do to protect my body and my sense of enoughness, it doesn't include that, right? So how can someone, try to take steps to get better without just feeling like the answer is weight loss, the answer is weight loss, the answer is weight loss?
The thing is, the reason, and I see this all the time because I think I'm one of the few doctors who sees only PCOS patients in my office with endometriosis all day long. And the reason these patients have disordered eating, even though some of them don't have an eating disorder, but they all have almost this disordered eating, is because they've been dismissed. It's because their PCOS was never diagnosed in time. It's because their insulin resistance was never treated. If you treat these teenagers and educate them, they will never go down the path of an eating disorder. They do it, they get there because of that frustration. I think as for women, self-confidence is the most important gift. When one day when you have daughters running around, the biggest gift you can give your daughter is the gift of confidence. If they have acne, why not fix it? If they have hair loss and they're looking at age 25 to get hair transplant, why not help them? All of that, whatever makes them feel better, why not do it? So it's not only for me is not only to my goal is to get them healthier, but it's also to give them back the confidence because it's only when you start loving yourself, you have to love yourself. And a lot of these patients start going down the wrong paths. They're depressed. I see them every day. So it's really heartbreaking for me to, as a mother of 4 daughters, confidence. I'll do anything for my patients to give them back their confidence. And I think it starts with the correct diagnosis, number one. Number two, you have to understand what's going on with your body. If you give a birth control pill to someone with irregular period and push them out of your office, they're going to go home. They're not even going to know why they're taking it.
That's what happened to me at 14.
Yeah, because you're going to go home and you're like, no, because your grandma's going to come and tell you, if you take birth control, you're not going to have a baby. And then people scare you and you stop it. But if you take the time to explain to patients why metformin, why do you need to take spironolactone, why do you need to exercise, why is it that you have to walk 10 minutes after you eat, why this supplement will help you, why birth control, why this birth control, and not, you empower them to know what's right for them.
While we're talking about birth control, I have so many questions about this. Do you think there is a best form of birth control?
So it depends on what you're treating, right? For example, for my patients with endometriosis, I try to give them progesterone only birth control pills because they respond better. It helps their pain better. I stay away for combination birth control pills that are very high dose in estrogen. For patients who have acne, I might pick a birth control pill that's very anti-androgenic. Yasmin, Slind, which is a progesterone only birth control, it's very anti-androgenic. So you pick and choose based on what you're trying to treat. For someone who has irregular period, you can do a combination birth control pill. Generally speaking, I start with the least amount of hormones, no matter what. These are synthetic hormones. So if I can use the lowest dose, I always do. I love low estrogen, and I'm not advertising. I'm not getting paid for this.
Yeah.
I'm just telling you what I use so people can listen. But for my PCOS patients, I like Slind, especially the ones with painful periods. But low estrogen is very low in estradiol, so I use that too.
The next question I had for you was just, is it bad to be on a hormonal birth control? And I'm assuming you're going to say no if you're on the right one, right?
I was on birth control pills, combination estrogen, progesterone for 9 years. The minute I stopped it, I got pregnant that following month. But I didn't have endometriosis. I didn't have PCOS. I didn't have any other hormonal issues. Birth control pills are an amazing method. They're very safe, very well tolerated. You just have to be compliant with it. I'm talking about the pills. The only thing I will tell you is birth control pills do suppress your ovary. So if you're going to stay on birth control pills for past 7 years, you better check your ovarian reserve. Anti-Mullerian hormone is an egg count test. I do it at any age on my patients. You can be 15 if you come in and you have painful periods and I worry about endometriosis, I check your egg count. But so it's good for patients to check their egg count once a month. If you're on combination birth control pill after 7 years, if you start declining in your numbers, freeze eggs or come off of it. Chronic, small percentage of patients, when they take combination birth control pills for many, many years, they can get chronic suppression of their ovarian reserve, which we don't want to do. So that's why it's important. Now, if you do IUDs, progesterone IUDs, they don't suppress the ovaries. You're still ovulating. So for patients with endometriosis, I like progesterone IUDs because I let their ovaries be, because these patients need long-term suppression without giving them oral birth control pills.
What IUDs do you like for patients with PCOS?
For any patients, if you've had children in the past, Mirena IUD. If you haven't, I love Kyleena IUD. It's a progesterone IUD, 5 years. It's very small. It's not as big as the Mirena. So when you place it, patients don't have the extreme pelvic pain that sometimes they experience with Mirena IUD.
And while we're talking about hormones, if someone says, I have no idea what's going on with my hormones, what's in balance, what's out of balance, what questions do they need to ask? What should they do to figure out what's up with their hormones?
First of all, if you have regular menstrual cycles every 28 days and you don't have pain and you don't have acne, hair loss, facial hair, body hair, and life is good, your hormones are probably fine. But if your periods are all over the place, they're irregular, you have acne, you have facial hair, body hair, you're gaining weight, you can't explain it, then all hormones need to be checked. Not only, in my office, I check testosterone free and total. I check DHEAS, which is a different type of androgen. I check a full thyroid panel. Believe it or not, thyroid conditions are very common and it's a simple test. And I also check a prolactin for patients who have irregular periods. So, you can do that, but I keep repeating myself, but I really want every single woman, but every girl by age 18 needs to know her egg count. You'll be surprised. Sometimes I catch 15-year-olds with an egg count of a 40-year-old. And those patients, I suppress their endometriosis. And as soon as they're 18, I have them freeze their eggs.
Okay, let's talk about that, because I think not being as fertile as you'd hope is a fear that a lot of women who want to have kids, have. What is the number one thing you recommend all women can be thinking about to prevent infertility in the future? What's the question we ask, the test we try to get? I have asked about my egg count or something to a male OBGYN a few years ago who was like, "Oh, it's too soon, you're fine."
It's never too soon.
The fact that you just said at 18 you should know your egg count, I'm like,
Have 18-year-olds freezing eggs, because endometriosis can start at age 8 and it can start destroying your ovarian reserve, right? So you can't ignore that. So going back to your question. Number one, if something doesn't make sense, you need to go see a gynecologist or your primary care doctor or your pediatrician. If your symptoms are dismissed, Google it, put it in ChatGPT, and then find the doctor who specializes in that. Starting number one, when you first get your period, it's normal up to age 18 or 19 to have irregular periods. But if your irregular period is also combined with acne and hair loss and facial hair and body hair and weight gain and all these other symptoms, you probably have PCOS, right? I actually have a calculator on OV.com, OVII.com. It's free. People can go answer questions and I'll tell them whether or not they have the likelihood of having PCOS or not. I can't diagnose them, but I'll tell them whether or not they have the likelihood. So make sure for fertility, you don't have PCOS. 15% of women have PCOS. 2, make sure you don't have endometriosis. 10% of women in this country suffer from endometriosis. Endometriosis doesn't have a blood test, doesn't have an ultrasound. A majority of the time, everything's normal. But these patients have painful periods, painful sex with deep penetration, pelvic pain. Pain is an issue with these patients. And they end up getting colonoscopies and they get diagnosed with IBS. They get diagnosed with every single diagnosis except the number one cause of chronic pelvic pain in a woman in a reproductive age, which is endometriosis. So make sure you don't miss that. Number 3, I would say, get your egg count checked.
And so we just walk in and say, "I want my egg count." You call ahead, "I want to get my egg count checked."
So here's the problem. I said this on one of the podcasts, and one of the interns who used to work with SheMD came to me one day and she's like, "Dr. A, I listened to your podcast. I think I have endometriosis." So I made an appointment. I went to my gynecologist in LA. She goes in, she was like 24. She goes in, she's like, "I think I have endometriosis and I want you to check my egg count." You know what the doctor told her? Her gynecologist. She said, "It is malpractice for me to check an egg count. You're too young."
What?
Put yourself in my shoes now. That's what I hear all day long. Thanks for these podcasts and Google and ChatGPT.
I love that you're hyping up ChatGPT.
Oh, I love ChatGPT.
I think it's true. Like, even these questions I have where I'm like, does my OBGYN do the egg count? Do I go somewhere else? I'm like, I should just ask Chat. I want to get my egg count checked. Tell me the 6 steps to take.
I'm going to have a Dr. Aliabadi robot. I want to send this robot to all Afghanistan, to Thai, to all these countries where women get dismissed, including here. Because you know what? You can train AI. Trust me. Go to ChatGPT tonight and say, "I have irregular periods. I have acne,
Be very
facial
specific,
hair,
very
and
detailed.
body hair."
Yeah.
Right? Common. What is my diagnosis? Right? You're going to get the right diagnosis.
That's wow. So, gonna ask to get our egg count checked. Anything else we need to know? Let's say they say it's low, medium, medium or it's low. Then what do we do?
So if it's low, you have to see why it's low, right? If you're 20 years old, you should not have a low egg count. PCOS patients, polycystic ovarian syndrome, it's not cysts, it's follicles. They tend to have a very high egg count, right?
Woo.
But the quality goes down after 30. So that's why if you come to my office, I have you freeze your eggs between 28 and 30.
The way that I'm Dr. A, I'm like, take all my money. I'm going to call your office after this.
So check your egg count. If it's low, freeze. There's no such thing as being too young. I have 20-year-old freeze eggs, right? And if you freeze eggs, you want a minimum of 20 eggs on ice. The more, the better. The younger you are, on average, every 3 eggs gives you 1 embryo. The older you are, let's say at 40, every 10, 15 eggs will give you one embryo. So the older you get, the more eggs you need because the quality goes down. With PCOS, because the quality of the eggs go down after 30, you want to freeze them before that. Endometriosis pushes down count and quality. So if you have a patient, PCOS and endometriosis, you don't know which one's causing. Is it, is the endo taking over and pushing the egg count down? Or is this patient still maintaining her egg count? The only way to do that is A, to do an egg count, and B, if you have pelvic pain and symptoms of endometriosis, to fix it.
I gotta get my eggs on ice, man. Holy shit.
No, because you have a partner.
I know, but like,
if you have a partner, you don't freeze eggs, you freeze embryos.
Yes, that was a tip that you gave on your podcast I loved. So what Dr. A is saying is if you know this is the partner you're going to have kids with, you can actually freeze the embryo that has been fertilized.
Yes.
And you've done, that's a huge step.
But you have to remember, you better be 1,000% sure, because the minute you make embryos, they're not yours anymore.
Yeah.
So if you have any doubt, freeze eggs. The problem with freezing eggs is we don't know the quality of it, right? I just know the count. So I tell my patients 20 and then they freeze 20 and they come back. I'm like, will you kill me if I send you again for like 20 more? And they're like, what? You said 20. So 20 is minimum when you're young. But for older patients, for PCOS patients, I tend to want more eggs, which is fine. But with eggs, we don't know the quality. With embryos, we know the quality. That's why embryos are better.
So it sounds like, so I was going to ask you, what are the top questions you think everyone should be asking their OBGYN? But I think what we can take from this is check in to see if you have any of these diagnoses that you've mentioned today. Check your egg count.
And for women, past 25, know your lifetime risk of breast cancer. How about that?
Let's talk about
that
as
well. Put a twist
well.
on that. So besides endometriosis, PCOS, going back to that, every single girl needs to have a normal pelvic ultrasound documented in the chart at some point. Obviously, I don't recommend it when they're not sexually active, but once you're sexually active, have your doctor do a pelvic ultrasound. It takes me less than a minute to do an ultrasound. It's a transvaginal ultrasound. I look at the uterus. I make sure they don't have any polyps, fibroids. I make sure there's no septum or division in the lining of the uterus. I make sure the ovaries look good. There are no cysts on the ovaries. There's no endometriosis or endometrioma on the ovary. So I check for everything. I put a check in front of a pelvic ultrasound. I put a check in front of the hormones. I put a check in front of the egg count. And I make sure they don't have PCOS and endometriosis. Then I do their pap smear, I do STD testing, and everything else that every other doctor does. So that's one. Then every single woman needs to know her lifetime risk of breast cancer. It's very important. By 30, everyone needs to know. Just like you know your name, your last name, your date of birth, and your social security number, you have to know your lifetime risk of breast cancer. It's a formula. We actually have it on SheMD. Again, it's free. You can go. You enter some information about your height, weight, density of your breast, family history, when you got your first period, age at your first pregnancy. Basically, it's very self-explanatory. And we ask information about your family history, and the computer will calculate your lifetime risk of breast cancer over 10 years and over your lifetime. And usually you take that lifetime risk. If that lifetime risk is 20% or more, patients need to start imaging as early as 30. So if you go to the doctor, the first thing they're going to tell you is you're not 40, you don't need a mammogram. That's not true. How many times have you heard? Well, you haven't heard it because you're young, but women hear it all the time. You're too young. My friend died of stage 4 breast cancer because at 39, she had a lump in her breast, and her doctor in Santa Monica told her, you're too young for a mammogram. 6 months later, she came back with stage 4 breast cancer. So lifetime risk is very important. An average American woman has a lifetime risk of 12.5. 1 out of 8 women will get breast cancer. Majority of women who get breast cancer don't have any family history of breast cancer. Can we talk about that? Because I still order a mammogram and they're like, I don't need to do it because I don't have it in my family. I didn't have it in my family. I didn't have a gene mutation. I didn't have anything, but I was one of the 1 out of 8 women who got breast cancer. So 1 out of 8 will get breast cancer. If your lifetime risk is 20% or more, you have to start breast imaging at 30. And you can start with mammogram and ultrasound. And for high-risk patients, you have to alternate that with a breast MRI. So even mammogram and ultrasound is not enough. So the other thing I want to talk about, at 25, every single woman needs to do a cancer genetic testing if they have any cancers in their family, not just maternal side, paternal counts too. So if you have a paternal aunt with breast cancer, you need to do a genetic cancer testing. The reason we do it at 25 is for patients with genetic mutations, 2 of them being BRCA1, BRCA1 and 2, you have to start breast imaging at 25.
Wow.
So mammogram, ultrasound, and MRI at 25.
I'm 2 years late to some of this stuff. For everyone listening, we'll put on the @RealPod Instagram account, we will make a cute little graphic so it feels a little lighter of all the things Dr. A is saying that you need to do by what age, okay? So go to the RealPod Instagram when you're listening to this. It's going to be there. That brings me to my last thing I want to talk about with you. It is scary. It's overwhelming. I feel like so many people can relate to going to the doctor's office and then like walking out and maybe feeling like they're going to cry because they're like, I don't have time to do this. What am I supposed to do? Like, what would you say to encourage or comfort women to like seek these answers and do this because it's so important?
There's only one way around it, and it's they have to be their own health advocates. So if you close your eyes and go to an office visit and you're using your insurance and your doctor is going to spend 5 to 10 minutes with you, nothing will get diagnosed, nothing will get done. If they have time, they will do your STD check, they will do your pap smear, they will touch your breast, and you're out of there, right? That's what happens for majority of these office visits because doctors are so busy. And, you know, when you see insurance patients, you only literally have 5 to 10 minutes per patient. Otherwise, you can't pay for the office. So in that situation, the only way is to advocate for yourself. In order to advocate for yourself, you have to be educated. That's why, I mean, your podcast at GMD Podcast, I mean, we cover every topic from menopause to breast cancer to endometriosis to PCOS. Every single topic is covered. Why? Not that I have time to do these podcasts. I do it because I can't see all patients, right? But I want to empower women at home to be their own health advocate. If I'm telling you, if your periods are painful, if you're sitting at home, if you're skipping school, if you change your social plans every time you get your period, if you end up in the ER with pain, that's endometriosis until proven otherwise. Educate yourself. Watch podcasts on endometriosis. Then have all your answers. Be empowered. When your doctor walks in, say, I'm here because I'm 22 years old. I have really painful periods. I need to know my egg count. I need to check. I need you to rule out PCOS because my periods are irregular and I have acne and I have facial hair. So if you go in, or if you go in and say my lifetime risk, I'm 30 years old, my lifetime risk is 35%, and I know that above 20%, I need mammogram, ultrasound, and MRI, so I need you to write the orders. If they don't, then you know you're in the wrong office, right? So a doctor who tells her 24-year-old patient doing an egg count is a malpractice, you don't need to go back to that doctor. But until you're empowered and you become your own health advocate, no one's going to do it for you. And that's why these podcasts are life-changing. They really are.
Thank you so much, Dr. A. We are so grateful for
you're so
everything you shared. I hope everyone
sweet.
goes and follows you and listens to GMD. And I'm just so grateful for the
You're
work
so
that you do. So thank
sweet.
you. You're literally the best. I want to be your friend.
I want to be your friend. I want to come hang out here.
I know. Thank you so much.